Hi, everyone. My name is Veronica Somerville, and I am the NC TOPPS contact and super user here at Partners Behavioral Health Management. I welcome you to our NC TOPPS training. So we will go ahead and get started. All right. So coming into this training, you're probably like, what is NC TOPPS? So NC TOPPS is a web-based system for gathering outcome and performance data on behalf of mental health and substance use consumers who are receiving services that require an NC TOPPS submission. So NC TOPPS is North Carolina's public system for collecting data on treatment services and quality of those services. NC TOPPS was launched in 1997 as a partnership between the federal and state government, and then it was moved to a web-based format back in July of 2005. So you're probably wondering, so how does this whole NC TOPPS thing work? So NC TOPPS is based on face-to-face interaction between a consumer and a QP with the objective of enhancing the clinical assessment process and providing information for the consumer's treatment plan. This is done through the initial, update, and episode completion interviews, and they are designed to assist in assessing the effectiveness of treatment. So this is done through initial interview, which is the first interview. And it's designed to gather information on consumer demographics and pre-treatment behaviors. So this is required to be done face-to-face within the first or second treatment visit. The next part or essential part of NC TOPPS is the update interviews. These are done either 3 months, done on the third month, 6 months, and 12 months. 12th month, and then after the 12th month is done biannually. So these update interviews are used to gather information on the consumer status changes and treatment outcomes. So when getting started with NC TOPPS, the first thing you'll need to do is set up a user profile. So to do this, you will go to the NC TOPPS main website, which you see here on the slide, and then you would click on NC TOPPS 2.1 website. Then you'll click on the new NC TOPPS user profile. You'll enter your name and unique email address, and then you will follow the on-screen instructions to select the LME, MCO, and provider agency that you belong to. Okay, after your request is completed, the system will prompt you to create a secure NC TOPPS account, which right then you will be required to create a password and answer security questions that will help keep your account secure, because you are dealing with a lot of PHI, private information from the consumers. And after you create your password to kind of secure the security of your account, then you will a username will be assigned to you by NC TOPPS. Your new user request will be then emailed to your provider agency super user or your LME MCO super user, which will be myself, Veronica. The super user will approve or deny your request, and you will be notified by email. So you've heard me say super user a couple of times already. And so I'm kind of going to give you an idea of what a super user is. So a super user is an individual who has oversight responsibilities for either for the LME, MCO, or their provider agency. So that is my role here at Partners. Super users are able to track NC TOPPS submissions and due dates for their agency, create a consumer's change a consumer's QP, as well as manage user enrollment requests, which are what I just was speaking about in regards to when you create your user profile within NC TOPPS. Your super user at your agency would be in charge of approving or denying those requests. So that is definitely one of the important roles of a super user that is really important. So next is the CNDS number, or the Common Name Data Services number for NC TOPPS. For Medicaid recipients, the CNDS number will be the same as their Medicaid ID. For individuals not enrolled in Medicaid, partners will need to provide the CNDS number for that individual when they're admitted into NC TOPPS by participating in a service that requires NC TOPPS. So if the individual is Medicaid eligible, the CNDS number will be the same as their Medicaid ID number. But if he or she is IPRS only, NC Tracks would need to create their CNDS number, and then in that moment you would need to contact your LME MCO contact person, who will then assist you with obtaining that number. Here at Partners, our contact for that is Melina Wilmoth, and you'll see her email address here. And in that instance, you would need to send her a confidential email through the Zix mail portal. And in that email, you would need to include the individual's name, social security number, and date of birth, and Melina would be able to get that CNDS number set up for you. Okay, so in preparing for an interview, the NC TOPPS interviews include common information generally collected as part of developing and revising a mental health and substance use consumers treatment plan. It is important that the QPs are familiar with the interview questions prior to contact with a consumer, because it helps it flow a little bit better. It's good when the consumer may have questions about particular questions that you're already familiarized with them, so that you may give them an answer that, or be able to help them better understand what the question is asking them, so that we can help provide the most accurate information possible. So prior to sitting down with the consumer, it's important that a QP should practice with the different items in NC TOPPS, and you can do that by using username training and password training. So I highly suggest you definitely should check that out and just kind of play around and get used to and get comfortable with NC TOPPS and how to navigate through the site. So all items in the interview are required to be answered before you can submit the interview. There are certain items on the update and episode completion interview which are important in determining consumer outcomes that are required to be answered either in person or over the telephone. And so for updates, these would need to be completed within 2 weeks of the NC TOPPS interview due date. All right, to submit an NC TOPPS interview, you would go to the NC TOPPS main website. You would click on NC TOPPS 2.1 website, and then you will log in with your username and password, and then go to the Locations tab and select the appropriate LME, MCO, and provider agency location. Here's a screenshot of what that locations tab looks like and what the NC TOPPS website screen looks like. So as you can see, as soon as you highlight over that, hover over that locations tab, a drop down will come that will allow you to select the appropriate LME MCO. And then as soon as you hover over that LME MCO, then it'll provide the locations that are associated with your profile. So this is a great way of kind of like familiarizing with yourself with that, but that's the locations tab. So once a location has been selected, then the website submission tab will appear, and you will select start initial interview to start an initial interview. Or if you're trying to start an update or episode completion or a recovery follow-up interview, you would select manage episodes of care. And here's a screenshot of that. As you can see, different from the other screenshot, website submission is now available next to locations as a selection, as an option. And once you hover over that tab, it'll give you two options, which are start initial interview if you're looking to start an initial interview, and manage episodes of care if you're looking to start an update or episode completion interview. So here's just a little snapshot of what that screen looks like. So there are 3 features available for qualified professionals or QPs. So the first one is interview search. This feature allows you to search for any interview within your NC TOPPS profile, and that information that information that is used in this search that you can use to look for the consumer is through the various criteria, such as the consumer's information, such as a consumer record number, their QP username, their date of birth, their consumer initials, gender, interview status, date started in range, submitted range, their consumer group, their interview type and location. And this tool allows you, or this feature allows you to be able to print or export this information into an Excel document. It's pretty neat. We use it with validating and checking our CNDS numbers. So it's definitely a unique and cool tool to use with collecting that kind of information or trying to find information on a particular consumer. Okay, so here you can see next to the website submissions tab is reports. And this is where you'll see the interview search, and you'll see it's right below the reports tab, and it's the first option that you have to select. So here's a screenshot of what the actual interview search screen looks like. You can search by, as you can see over on your left side, the consumer record number and the consumer information is all those things that I just listed that you can utilize to search for an interview. And then you can see that once you've selected or found that interview that you were looking for, you can click that print button. So, and also at the bottom, there's an export data option at the bottom on your left. And that's where you would export it into an Excel document. So 2 of the other features that we're going to go over today is the updates needed list, which is used in helping you track the date that updates are due for a consumer. And then the individual report, this report shows you allows you to select NC TOPPS items from the initial interview and the two most recent updates, and allows you to be able to use those reports and allow them to be shared in the with the consumer in their person-centered planning. So these are two features that are very useful. With the updates needed list, I definitely suggest that the super user or you yourself, the QP, definitely keep an eye on or look at this list weekly so that you can keep yourself up to date on what is due. So those due dates will be met. That's definitely something that we want to be done. We don't want any late submissions. So it's best to be on top of it by looking at that list weekly so that you can plan ahead of time to make sure those are completed on time. So here's a screenshot of what the updates needed list. Yes, the updates needed list is definitely here, but it kind of shows you what that screen looks like. So as you can see, it's right under the interview search option, and it'll give you a whole list of all the consumers that have interviews that are coming up that will need to be due probably within the next 30 days. Then you could either click to print that out, or you could export it out into an Excel document. But these are definitely two features that are very helpful. So data entry users, or DEUs. These are non-QP staff within a provider agency who are allowed to enter NC TOPPS interview data on the behalf of a QP. In these situations, the QP must sign the NC TOPPS form, and the original interview with the signature must be placed in the chart if there's copies made. But that signed copy needs to be in the chart for the consumer. All requests for DEU statuses are emailed to the super user, and then the super user will either approve or deny that request. So NC TOPPS implementation guidelines. NC TOPPS interviews must be included in the consumer's record, and the consumer is expected to sign the copy of the submitted interview. Adults and adolescents can sign their own, but the child interviews need to be signed by a parent or a guardian. Consumers, provider agency changes. The QP as a new provider agency. Now repeat, the QP as a new provider agency must notify the LME MCO and request for the consumer to be transferred to their agency. I get a lot of questions about this. This is usually whenever you're trying to submit that initial interview and they give you an error message saying that this consumer already has an episode of care open. This is usually that moment when you're notified, like, okay, I need to connect with the LME MCO and ask for them to help me with getting this transferred getting this consumer transferred. And so in order to have this transfer completed, the QP must submit an authorization to release information for coordination of care form to the LME MCO. And so this pretty much is a protection for HIPAA. The federal laws require that provider agencies must obtain explicit consent from a consumer before sharing any PHI, including NC TOPPS data, with other provider agencies for the purpose of coordinating care. So this is very important. We definitely want to make sure that this is done whenever it's time for a consumer to move on to a new agency or a different agency, and that the proper channels are used in getting this, getting the consumer transferred in the system of NC TOPPS so that we can continue instead of doing an episode of completion. We definitely want to continue that on so that we can have a full picture of that consumer's treatment. So definitely want to make sure that we utilize that form. We here at Partners, we have our own form, and that form can be found on our NC TOPPS webpage on our Partners website. I will be, you will be able to see that at the below where this training is posted. So definitely utilize this form, save it, make sure it's on hand at all times so that when those times come, you'll already know that you need to go ahead and fill out this form and then send it in and fax it to us. And the fax number is found at the bottom of that sheet, and that fax number is 704-884-2724. So that's something very helpful to have and to know for the future. So initial interviews, as I stated before, these are done at the beginning of an episode of care. These interviews are normally done in person within the first or second treatment visit as part of the consumer's treatment plan. If an initial interview is missed and the consumer is still receiving services, an initial interview needs to be submitted and completed and submitted as soon as possible. And if an initial interview is missed and the consumer is no longer receiving a required service from that agency, an initial interview is not should not be submitted. If the NC TOPPS system does not allow allow the QP to complete an initial interview on a new consumer, the QP should contact their LME MCO to receive access to the consumer's NC TOPPS submissions and then administer the NC TOPPS update interviews on the previously established schedule. So once that consumer is transferred, once you contact us and we've transferred the consumer and submitted that form, from then on, once they're transferred, you will not need to complete an initial interview. You would just continue on with their schedule if they needed a 3-month or 6-month or 12-month. So you would pretty much just adapt the schedule that they had with the previous agency. So an update interview must be completed within 2 weeks, prior or 2 weeks after the update due date. Okay. The timing of the appropriate update is based on the day that the initial was submitted. So, for example, if the initial interview was started on or submitted on January the 3rd, 2020, and the 30-month update, so then the 3-month update is expected to be submitted on the due date of April 3rd, 2020, and the 6-month update is expected on July 3rd, 2020, and et cetera, et cetera. If an update is not completed on time, it is still required to be completed 2 weeks before the due date to 30 days after the interview is due. If an update is missed and another update is now due, only the current update due can be completed in the NC TOPPS system. For example, if a 3-month update is missed and it is now time for the 6-month update to be submitted, only the 6-month update interview will be able to be completed. So it's important to make sure we get these updates in on time, so that you won't have those kind of issues. and so that we're collecting all the data for that consumer. So in the last instance is that there will be a need for an episode completion interview. And an episode completion interview would need to be submitted once a consumer has successfully completed treatment, has been discharged from the program, if they have refused treatment, if the consumer has not received any services for 60 days, change to a service that does not require NC-TOPPS, if they have moved out of the area and changed to a different LME NCO, if they've been incarcerated or institutionalized, or if they have died. These will all be reasons for an episode completion interview to be completed. So once a consumer has a episode completion interview that's been completed, the next QP that they would have at an agency would then have to complete an initial interview for that consumer to start a new episode of care. So NC-TOPPS is designed to follow a consumer across an episode of care. So an episode is defined as a period that begins with the initiation of services and ends with the termination of services, or with a lapse in services of 60 days or more. A consumer who returns to services after a lapse begins a whole new episode of care. So they would have already had their episode completion interview, and if they were to come back after those 60 days, then a whole new initial interview would need to be completed. So for consumers receiving mental health and substance use disorder services, an initial interview must be completed at the beginning of an episode of care, followed by their updates, so the 3, the 6, and the 12 months, and the other biannual updates as necessary, and an episode completion interview at the end of an episode of care. All NC-TOPPS interviews must be entered into the web-based system by the QP or the data entry user. All right, so there are instances where a consumer has more than one qualifying service, and the responsibility for the NC-TOPPS interview is determined by a hierarchy of services based on their age and disability. So pretty much it's a table that lists all the services in order, and the service that's highest on the table is the one that's responsible for NC-TOPPS, for completing the NC-TOPPS. So as services change, the NC-TOPPS record will be transferred to the agency providing the next highest service. So only one set of NC-TOPPS interviews is completed for each consumer during a particular episode of care. Okay, so here is a look at that table. As you can see at the top, that we have residential services at the top, partial hospitalization, we got ACT, SACOT, all of the familiar services. And with that, this would be a great time to see that residential services is most definitely at the top. So if a consumer is receiving opioid treatment from one provider and receiving residential services from another, according to the hierarchy, the residential services provider agency will be the agency that completes the NC-TOPPS interview, because it's at the top of the hierarchy. So this is a great tool, something that will be very important for you to kind of keep on hand. And this is found in the implementation guidelines that I'm going to go over very soon, and showing you where you can find that. So next you'll see the list of service codes that require NC TOPPS. This is also found in the implementation guidelines. You've heard me kind of mention those services that require NC TOPPS, and these are the services. So this is the first half of the list, and this is the second half. So we use these codes to figure out whether or not a provider agency has needs to submit the consumer's initial interview. And we use these codes in some of our outcomes reports, such as looking at our initial interview timely submission. We use these codes to help us with understanding or to see if initial or update interviews are submitted on time by crosswalking that information from our report with our claims data and what's been submitted in NC TOPPS. So some really good and useful information. Really take some time and really kind of look over that. Okay, so consumers receiving state-funded services only or both state and Medicaid funds. So NC TOPPS interviews are required for all adults and children ages 6 years and above who are receiving any qualifying service for a mental health or substance use disorder issue. In addition, NC TOPPS interviews are not required for consumers receiving only one or more of the following services, such as mental health outpatient therapy or medication management, psychosocial rehabilitation, crisis services, psychiatric inpatient hospitalization services, or developmental disability services and support. Consumers in opioid treatment programs. So all of the participants in the opioid treatment programs are required to participate in NC TOPPS. Whether or not they are private pay or self-paid, or if they're receiving funds from Medicaid or state funded, depends on where it needs to be submitted. So in NC TOPPS. So if the consumer is receiving only they're doing private pay or self-pay, the OTP would register them directly with NC TOPPS through going through the help desk and creating their own facility number. And that is how they would submit those interviews. But if they are receiving Medicaid and state-funded consumers, they must register on NC TOPPS with the LME MCO that is responsible for monitoring the agency, which will be us. And then those NC TOPPS interviews would then need to be submitted to us partners. So if the OTP is serving both private pay, and so if the people that they're serving, if they're both doing private pay and self-pay, and they're receiving Medicaid state funds, they would need to submit those in both profiles for both the self-pay and the LME MCO. So those are some really, there's more information about that in the implementation guidelines. So would highly suggest kind of looking at that and getting familiarized with that. If a QP is in a location where there's no access to internet, QPs can definitely print off the interviews to gather the NC-TOPPS information. This information must be entered but this information has to be entered in the web-based system by the QP or the data entry user. And these is where you can get the printable form. So once you go on the NC-TOPPS website, you'll see that these 3 links are available. And the one that you will need to click on is locate what you need to get started using NC-TOPPS. And then it will take you to this page where you'll see the link for NC-TOPPS guidelines. And what I was referencing earlier, and then at the bottom you'll see the printable interview forms, and it has a list of all the different interviews for each age group. And you can see that they have all kinds of other resources such as the NC-TOPPS Quick Start Guide, other NC-TOPPS tools guides, the frequently asked questions, which are all very helpful and useful. So there's many benefits of assessing the data in the reports on NC-TOPPS. Seeing successful behavioral health treatment outcomes can help instill hope in recovery for consumers that are newly entering services. And for provider agencies and LME and COs, it can benefit them by using the dashboard system to monitor the agency and service outcomes. Some of this evidence, especially positive service outcomes, can be used as a good public relations tool for behavioral health services, and showing this information to your community stakeholders. Okay, so reports of aggregate information. This aggregate information comes straight from the interviews, and this is accessible for everyone that uses NC-TOPPS. And you can request this data from the NC-TOPPS help desk if you're interested in receiving that information. So it's really some good stuff that can be used in reporting and showing your outcomes. So here at Partners, we have 2 quality improvement projects that are surrounded around NC-TOPPS. The first one is increase initial NC-TOPPS interviews. The goal for that is making sure that initial interviews are submitted on time within that first or second treatment visit. And our percentage goal for that is 80%. So our second one is to increase the percentage of consumers completing an episode of completing the episode of treatment being complete. So if you're completing an episode completion interview, we were looking to see that the reason would be completed treatment. And so the goal for that is 25%. Partners is still monitoring our in-person and telephonic combined interview method, and that goal is 65%, meaning that they're completed either in person or over the telephone. So I know you've heard me mention multiple times throughout this training about the interviews and the importance of making sure they're submitted either in person or over the telephone. And that's because it provides valuable information that comes straight from the consumer. We like to make sure that we're receiving that information, because once you look at the interviews, you'll see that once it gets to the point in the interview where it asks if the consumer is, if this information is being gathered either in person, over the telephone, or by record review, you'll see that if you click record review, it will not go to the consumer specific questions where you would need to have a response from the consumer. So that's why it's so important to make sure they're done either in person or over the telephone, because it allows us to receive the remaining part, that remaining information that's in the interview that has to come from the consumer. And these are just some of the valuable information that we would receive from the consumers. So looking at the interview method report, this report only captures data pertaining to questions regarding how the data was gathered. It shows a breakdown of how the interviews were collected, whether it was via in-person, phone, or record notes. In this report, you are able to select multiple consumer groups, as well as which interview type you would like to include in this report. So here you can see all three being captured. In this one, you can see that this section has more of a breakdown on whether or not the information was gathered via in-person or through the telephone. So it provides both graphs so that you can utilize that in your reporting. Okay, the next report is the simple query report. This report is used by super users at the provider agency and or LME MCO, and this provides them with access to generate graphs from the questions that are asked in the NC TOPPS interviews. Super users will be able to select criteria such as location, date range, age and disability group, and interview type to generate this report. Provider agencies and LME MCOs can use the simple query report to support outcome measures requirements and for accreditation and monitor service outcomes. So the simple query report only allows you to select one consumer group as well as the interview type. The simple query report covers many indicators such as attendance at scheduled treatment, episode completion data method, episode completion reason, and barriers to treatment. So these are just some screenshots of what those sections look like in that report. Really neat report. It allows you to really get an awesome picture, and it automatically generates the graphs for you. So it's an awesome report to use for your outcomes and really get an awesome picture of how well all your consumers are doing for particular services and so on and so on. Okay, the last report I'm going to speak about is the Outcomes at a Glance 2.0 report. The Outcomes at a Glance 2.0 report is a dashboard system that allows any public user to view and print graphs showing NC TOPPS outcome measures for particular age and disability groups for the LME MCO as well as provider agencies. You can access this dashboard by going to the NC TOPPS website and clicking on the NC TOPPS Outcomes at a Glance 2.0 dashboard. So this concludes the intro portion of the NC TOPPS training. Here you'll see our contact information for the NC TOPPS help desk, email address and phone number, as well as our partners' email address for NC TOPPS questions. we encourage you to utilize the NC TOPPS questions at partnersbhm.org email address, because this is an awesome source that allows these emails to go to myself and the rest of the quality improvement team. So it won't just be one person that you're reaching out to, that you can get a more speedy response. So definitely encourage you to use that email address, the NC TOPPS questions at partnersbhm.org email address. And we're also asking that you do not use any identifying information in this email address, only consumer medical record numbers. That concludes the intro portion of the NC TOPPS training. The next part, the next section that I'm going to go over is specific to super users. So I wanted to separate the two so that those that are just QPs and you just needed the basic information about NC TOPPS, then you don't have to sit for the whole thing. So that concludes that portion. And I'm going to take a small moment, and then I'll get started with the NC TOPPS super user portion of the training. All right, so we'll go ahead and get started with the NC TOPPS super user training. I thank you for joining me and learning a little bit more about your role as a super user. If you were in there with me for the intro portion, you'll kind of see that some of this stuff is repetitive, but good information for the super users to know that are specific to them. So, what is a super user? A super user is an individual that has oversight responsibilities for their provider agency or for the LME and CO, as myself. And each agency is required to have at least one super user. Super users have access to the same NC TOPPS features as QPs, such as the interview search option, the updates needed option, but they also have access to other features, such as being able to change a consumer's QP, manage the user enrollment request, and to really track and monitor NC TOPPS submissions and due dates. So how do you become a super user? Okay, so if you're already an approved NC TOPPS user for your agency, so all you then would need to do is contact the NC TOPPS help desk to request the super user enrollment form, or you can contact us here at Partners through the NC TOPPS questions at partnersbhm.org email address, which I'll provide at the end. You can either contact us there and request that super user enrollment form. And once you have that form and you've completed it, you'll then email it to NCTOPPS at ncsu.edu. And this is the NC TOPPS help desk email address. And then they will set you up in the system as a super user so that you can have access to those external tools. So if you're a new user for an agency and you need to enroll in the web-based system as you would need to enroll in the web-based system as a QP and then be approved before you can apply to be a super user. So here are some of the super user tools. This is a screenshot of what your screen would look like as a super user. You'll see that instead of being right next to the locations tab, there would be the website submission tab for a QP. You have the super user tools tab next to locations. And in this drop down, you'll see that you have access to a user search, a code book, manage user request link, remove users link, and change consumers QP link. So these are all the responsibilities and things that you have as a super user or access that you have to in NC TOPPS. All right, so let's dive a little deeper into the manage user request. So how do you do that? So when you get an email to approve a new user, you'll log in with your current NC TOPPS username and password. Then you will click on the Locations tab to select select the LME NCO and provider agency in the blue bar next to the top of the page. Once you choose the appropriate location, the Super User Tools tab will appear next to the Locations tab, and then you will be able to click on the Super User Tools tab and click on Manage User Requests. Then you will see names of prospective users in your user management request queue. If your queue is empty, you have no users that are waiting to be approved. If it's not, you will see a list of users, and you will select approve or reject on the far right end of the row. And the user will go either into items for approval or rejection. And so I'll go ahead and start looking at this, show you the screenshot. So as you can see, you see where I have it, where you can click the approve or reject button. And then where the two sections they have below, which are items or users to be either approved or rejected. So once you click either approval or rejection, they'll move to their appropriate boxes. And then once you looked over it and confirmed that these people either indeed need to be approved or rejected, you would click the confirm button at the bottom of the page to save their approvals or rejections. So removing users. As the agency super user, you should always remove users when the staff persons leave your agency. You'll do this by clicking on the Super User Tools tab and then clicking on Remove Users. You will see a list of active users at the provider agency you have selected. You'll find the row with the username you wish to remove, and at the far right end of the row, you'll click the Remove button and then click Save Changes at the bottom of the page. So here's a screenshot of that page. As you can see, you'll find the username for the staff that has left your agency, and then you'll click the Remove button on the far right. And then once you have selected all that need to be removed, you'll click the Save Changes button, and they will be removed from your provider agency user profile. All right, so changing a consumer from one QP to another. So you'll do this by clicking on Change Consumers QP under your Super User Tools tab, and under the Episodes of Care listing, you'll check the box next to the consumer you want to modify. And at the bottom of the screen, you will select the new qualified professional you would like the selected consumer to be changed to. Click the Modify Episode button at the bottom of the page to save the changes. So here's a screenshot of that. You can see the box that would need to be checked next to the consumer to select who you would want to be modified or changed to a new QP. And then you would go down to the bottom and click on the new qualified professional that you would like to have the consumer change to, and then you would click Modify Episode to save that change. So as a super user, you have the ability to go in and look for interviews that are incomplete. So you would do this by clicking on Manage Episodes of Care. You will find the interview that was started under Episodes of Care box, under the Episodes of Care box, And in this section, in this box, it would have all the interviews that are incomplete. You'll select the row of the consumer and then get the interview by going to the second box labeled list of interviews for selected consumer. And then you may need to scroll down in the second box to get to the interview that needs to be resumed. But then once you find it, you'll select resume to finish and submit the interview. So here's a screenshot of what that looks like. You'll see the episode of care box and how it has the list of interviews, and then you would click then you would click resume, and then it would drop down to the bottom, and then that's where you would reconvene. So let's do it here. So now you can see that that interview was selected, and then it went straight down to the bottom to the list of interviews for selected consumers, and then you were able to click on resume, and then allows you to go into it and finish the interview and submit it. Okay, super user information that is specific for partners. So partners BHM will be monitoring reports for updates needed for your agency on a regular basis. Also, NC TOPPS outcomes data through the simple query and other reports within the website. So we use all those reports to come up with our big picture of how we're doing as a network, but we also look at the individual agencies through our quarterly performance scorecard that we send out quarterly. So right there is definitely a good representation of what we provide in that scorecard. Provider agencies demonstrating significant issues with their NC TOPPS compliance will be contacted by us either by phone or email. If the problems continue, a plan of correction or other sanctions will be required because NC TOPPS is a requirement for us all to have done by through our accreditations and by the state. And so if assistance is needed, it's available through the contacts at the end of this presentation, which will be the NC TOPPS questions at partnersbhm.org email address. So I'll have that information at the end in case you need assistance on any of those things that you may be finding as an issue. So updates needed. The updates needed link is found under the reports tab under the interview search link. This report can be exported to Excel and printed. I suggest that you check the updates needed report on a weekly basis, and then you can keep track of when updates are due and plan accordingly for them to be submitted on time or by the deadline. So as you can see, you'll know where to find updates needed right under the reports tab, and then you can either print or export it using the links at the bottom of the page. Benefits of assessing data and reports. It pretty much allows you to see, allows you to help both the consumer and the provider agency by seeing successful behavioral health treatment outcomes. It allows that those outcomes allow the consumer to gain hope in recovery by looking at it, especially if they're new to entering the services, looking at their behavioral health treatment outcomes being increasing or improving would help instill hope. For provider agencies and LME MCOs, it can benefit, the reports can benefit them by looking at the dashboard system to monitor the agency service outcomes. It can also be used as a good public relations tool for community stakeholders. So it's a lot of great reports and information that can be collected from these interviews. So Another way is by contacting the NC TOPPS help desk and receiving like the reports of aggregate information. It kind of gives you like the raw data of all of the information that's collected through all of the interviews that you receive for your agency. So that information can definitely be requested through the NC TOPPS help desk email address, which I will provide at the end of the presentation. Okay, NC TOPPS, we have 2 active quality improvement projects right now. The first one is our increased initial NC TOPPS interviews timely submission. So the goal is to increase the number of initial interviews completed on time to being 80%, for our percentage to be 80% of our agencies within our network as a whole being at 80%. And so the next one is increase the percentage of consumers completing an episode of treatment. So it's really looking at the episode completion interviews, and the reason being for that episode completion being completed treatment. So we're wanting that to increase, and our treatment goal percentage for that is 25% for our whole network. So those are our 2 active quality improvement projects. We have one that has been sunsetted, but we still monitor it, which is the in-person and telephonic combined interview method. And the goal for that one was to have 65% of those interviews either completed in person or over the telephone. Okay, so now I'm going to dive a little bit into the reports that you have access to, which is the interview method report. This report only captures data pertaining to questions regarding how items are gathered. It shows a breakdown of how the interview was collected, whether it was done via in-person, through the phone, or from record or chart notes. You are able to select multiple consumer types with this report. So it's pretty neat. It gives you the breakdown of those 3. And it also gives you the breakdown of just the in-person and telephone methods as well. So the last report, the second to the last report I'm going to speak on is the super users report, which is the simple query report. And this generates graphs for questions that are asked in the NC TOPPS interviews. Super users will be able to select criteria such as location, date range, age, and disability group, and interview type to generate this report. Provider agencies and LME MCOs can use the simple query report to support outcome requirements for accreditation and monitor service outcomes. The simple query report only allows you to select one consumer group as well as the interview type. The simple query report covers many indicators such as attendance at scheduled treatment, episode completion data method, episode completion reason, and barriers to treatment. And these are just some of the screenshots from that report. And one of the other reports is the outcomes at a glance, and that can be found on the NC TOPPS website. And I kind of spoke on that one in the intro to NC TOPPS. So these were the reports that are specific to super users. So that is all that I have for our super users training portion of the training. If you have any questions, please send those to nctoppsquestions@partnersbhm.org. That is the email address to contact myself and the rest of the quality improvement team. And as well as here is the information for the NC TOPPS help desk. Please feel free to contact us if you have any questions. And I thank you all for joining me.